Hello and welcome to the Eating Disorder Therapist podcast. This is a podcast to help you find peace with food and overcome disordered eating. And I'm Harriet Frew, aka the Eating Disorder Therapist. And I'm so excited to share with you all kinds of stories, tips, information and guest interviews to help you on your journey in finding peace with food. So thank you so much for listening today. Now today I want to talk about a topic that doesn't get a lot of airtime. It's something that's normally a secretive eating disorder behaviour and has a whole heap of shame attached to it. And this is purging through self-induced vomiting. Purging could also include things like taking laxatives, slimming pills, detox teas, diuretics as examples as well. But for the purpose of this episode, I'm going to talk specifically about self-induced vomiting. And I also thought perhaps it's quite good timing to talk about this after my episode last week with Merritt and Sarah. From Texas who have developed actually, and it is now available, their Conquering Bulimia program. So if you are listening and you suffer from bulimia and you haven't listened to that episode, you might want to go back and have a listen to it. So let's do a bit more of a deep dive into this. So it's definitely not talked about enough. It's something that many more people struggle with than we realise, perhaps even if it's an occasional thing. And it's something as well that people can often feel very distressed about, and they feel very isolated in their coping with it. You know, you can feel really, really lonely, really, really isolated, really ashamed. And I see this as well as the darker and unexplored side of disordered eating. Now, I think, self-induced vomiting is no better or worse than any other eating disorder behaviour, but I think it's just something that doesn't really get talked about a lot because of the greater degree of shame. We talk much more openly about restriction and dieting. We talk more openly these days, thankfully, about binge eating, over-exercise, but not so much about self-induced vomiting. So obviously, to reduce shame, the best thing to do is to talk about these things. So hopefully by listening to this episode, bringing more out into the open, me talking about this today, it can help sort of like start to shift that, shame perspective that is held over self-induced vomiting a little bit more. Okay, now I know myself when I suffered with bulimia, I struggled with self-induced vomiting for 7 years, and I had periods where it was daily, several times a day, sometimes raging in its intensity, and other times where it was less frequent. But I kind of continued to struggle for about 7 years with self-induced vomiting. And it was a habit and a coping strategy that I really felt very attached to. It was really hard to break free from. I was always wanting to stop vomiting, but I would frequently relapse. I'd often have periods where I would do a bit better, but often I wouldn't normally be able to go more than about 2 weeks where I would fall back into it again. And this could be triggered perhaps with any period of emotional stress, or also lapsing back into overly restrictive eating, which of course then may be vulnerable to binge eating and then of course vomiting. So self-induced vomiting is most commonly associated with bulimia nervosa. And then if someone has bulimia nervosa, usually self-induced vomiting will follow binge eating. So binge eating, what do we mean by that? So it's when you eat a very large volume of food in a small amount of time. There's a loss of control, it's in secret. And I guess there's two types of binge eating as well. There's objective binge eating where you eat a very large amount of food, an objective large amount of food. And there's something called subjective binge eating as well, where you might eat a lesser volume of food. So say, for example, like a few biscuits or something, but these foods are eaten in a very bingey type fashion. You feel like that loss of control, you feel like you've done something wrong. So it kind of has all the associations associated with binge eating, but with subjective binge eating, it is the less volume of food. So just to make that distinction, because I know someone contacted me recently on Instagram about this and said they hadn't been aware of that distinction. So hopefully that's helpful for some of you listening. So self-induced vomiting is more frequently associated with bulimia and binge eating. However, it also happens in other eating disorders as well. So it happens in anorexia. So if someone has anorexia nervosa, then it's referred to as purging anorexia nervosa when someone is having sort of purges after eating episodes. And I guess the only difference between bulimia and purging anorexia is the BMI/weight, which of course we know is not the most reliable measure for many. So I guess just to clarify the distinction between the two in terms of how it's seen by the sort of DSM criteria, if you're binging and purging and your BMI is 16, then you'd have purging anorexia. But if your BMI was 18.5 plus, you would have bulimia. And it's quite arbitrary because I think for many people, a BMI of 18.5 would be underweight for them anyway. So yeah, I think, again, BMI, it's not really that relevant, but I guess I'm just trying to explain just how the kind of different kind of categories work, how it's kind of seen, I guess, by professionals. I think also really worth mentioning that I've worked with many people who are overweight and struggle with purging. And in recent years, many people who have gone down the bariatric surgery route are also, again, really vulnerable to struggling with this. And I've seen this presentation more and more frequently in the therapy room. So I think, again, something that just hasn't been sort of talked about in the past. So purging can also happen in OSFED, other specified feeding or eating disorder. So this is when purging might occur after a normal eating episode, so eating like a normal quantity of food rather than a binge. Or it might mean that you are purging after a binge, but you're not kind of doing it as frequently as someone who has a diagnosis of bulimia. Okay, so usually for bulimia, it's that you are binging and purging at least twice a week and you've been doing that for 3 months. But I think, again, with all of this diagnostic stuff as well, it's important not to get too tied up in this, because I think back to my own journey, and I guess at points in my journey, I probably would have been diagnosed with bulimia nervosa, probably predominantly. At other points, I might have had atypical anorexia nervosa when I was kind of a healthy weight, but I was being very restrictive, but I had a sort of phase of not binging and purging. And other times I might have met the diagnosis for binge eating disorder when I was binging but was no longer purging. And at other times I would have met the criteria for OSFED, other specified feeding and eating disorder. So it is very, very changeable. And I guess ultimately, it doesn't matter what your diagnosis is. Self-induced vomiting is a disordered eating behaviour. If you're doing this in an attempt to control your weight and shape and to deal with your negative emotions, then it needs to be taken seriously and you're absolutely worthy of support. I guess that's the key message. So how does self-induced vomiting start? So I think many people in our culture will have tried at some point to make themselves sick, even if they don't have an eating disorder. So we can be really vulnerable to this because of diet culture. We might have been in a severe dieting phase. We find ourselves one day really over hungry, maybe overeating, maybe binge eating, panicking about it and thinking, oh my goodness, I want to get rid of this food. Now, thankfully, most people are not always successful at making themselves sick, and it doesn't become a habit, doesn't become a regular activity. Actually, they try to make themselves sick. Thankfully, it doesn't work and they never go down that road. So there's an element of luck, really, in terms of how some people may or may not use purging. Now, I would say, as someone who struggled with purging for a long time, it was a very, very dark and desperate behaviour to be embroiled in. And, there was no degree of positivity around it for me. I hated purging so much. I hated the way it made me feel physically and mentally. So if you have tried to make yourself sick and it hasn't worked, please just be thankful that this horrible portal almost has never been opened up for you, because it's not worth it. And I think as well, once purging starts, I know for myself, I always thought this will be like a one-off, it's the last time, I'll never ever do it again. But it can become a habit, it can become quite addictive. You get a dopamine release often from the self-induced vomiting. It can feel like a kind of like relief of stress. Obviously, it's maladaptive coping. I'm not suggesting that people use this at all. But it can become quite have an addictive feel to it because of that, which is really, really unhelpful. And I think as well that once you know that you've got the outlet of purging, in a way you're much more likely to binge because you've kind of got that back door. So that can be a really slippery slope as well, because there's not really an end point for your binges. Because if you always know that you can purge to kind of get rid of the food, you can get really caught in this awful, awful, awful endless cycle. So practically, I guess people tend to purge when making themselves sick, usually in the toilet. However, when someone has bulimia or SFED, when they're purging, all kinds of secret tactics can follow, in terms of getting rid of food. People, and I include myself in this, will go to extreme measures sometimes to get rid of food, and things that you would never, ever, ever imagine yourself to kind of do. And I think, again, it can just really bring so much shame around this. So I just want to say as well, in talking about all of this, I'm absolutely in no way encouraging or validating this behaviour. It's severely destructive and it's really hard to stop once you get into a cycle of doing it. So I would say now, if you have any thoughts about considering doing this, don't do it. And if you're at the point of really wanting to do it, you should be seeking help, okay? Because it's not a normal or healthy coping strategy. And it's very rare that people fall into it as a kind of one-off thing. It almost opens a very dark hole to a very dark place, and it has severe consequences on the body and on your mental health. So I'm going to talk a bit more now about 3 aspects of self-induced vomiting in this deep dive. So think a bit more about the causes, dealing with ambivalence around change, being in two minds about change and giving it up, and then exploring some ways on how to stop. So causes of purging. So I think no one plans to start purging. I don't think that's something that we would normally think about. I know for myself, before I had an eating disorder, when I thought about people making themselves sick, I was just really confused why anyone would want to do that. It just did not make sense to me at all, okay? So normally the precursor to purging is a very strict diet, overly clean eating or restrictive eating, or something that's making you feel deprived. You're not having enough energy in for your body. And understandably, this is impossible to stick to sustainably, and one day or another, you're going to end up over hungry, overeating, binge eating as an understandable consequence, okay? As human beings, we are designed that when we have a shortage of food, we have a lot of hunger hormones. We feel hungry, we search for food, we're preoccupied by food. We are designed for survival, okay? So if you are in a place of restriction, you are highly likely one day to be very vulnerable to end up binge eating. Now, it doesn't happen to everybody, but you are very, very vulnerable, and there's nothing wrong with you. It's not that you don't have willpower. It's part of your human design, how you are sort of designed for survival. So what often happens when we've been restricting, you're more at risk of overeating. So then you're likely to eat to a point of being uncomfortably full. Or perhaps you've become so used to restricting your eating and your stomach being empty that having any food inside you as well can start to provoke intense anxiety. So trying to get rid of the food is often a desperate reaction to an overeating episode. When it happens, you probably plan to do it as a one-off. It's never going to happen again. However, as I've said before, once you start, it opens the door to a very slippery slope, and it's very common that then you start to fall into a real habit of doing this. So I remember the very first time when I binged and then tried to make myself sick. I was at a friend's barbecue after weeks of dieting, eating very little. And then I was at this buffet. There was unlimited food. And I was starving actually after weeks of deprivation. And I just remember I completely lost control. And it was really unplanned. I had no idea then what a binge was. It was a complete loss of control, a very dissociative experience. Once I started eating, I just couldn't stop. I had just got so hungry over weeks and weeks and weeks of deprivation. And of course, after weeks of strict dieting and then having this enormous binge eating episode, I was really, really panicky. And I remember feeling disgusted and ashamed of myself for the loss of control. And I just wanted to get the food out right then. Now, for me, this was the beginning of a horrible destructive cycle, because you think you're only going to do it once, but then once you know that vomiting is an option, it almost opens Pandora's box to eating, because there's no limit anymore. There's no need for self-control with eating. There's always a back door and an escape route. And of course, fleetingly, you might think, I found the answer, now I can eat what I want and just get rid of it. But I think for most people, actually, even if you might experience that in the very beginning, it doesn't make you feel good. I know myself, I loathed being sick. I hated the physical feeling. I hated the stomach pain and sore throat that lingered. And I think more for me as well, the emotional damage was worse because I felt so much shame about what was happening. And doing it made me really feel that I was like wrong, flawed, damaged, broken. I just really wanted to stop. Okay. And I think initially self-induced vomiting is more about getting rid of food and weight control, but quickly it can become very wrapped up in managing difficult emotions and a coping strategy for life. So binging or overeating and then purging can also be kind of quite a physical and violent act on the self, and it can become a release from negative emotions. Now, I know for me, it definitely became an unhelpful way of regulating emotions, feeling overwhelmed and frustrated with work, maybe feeling lonely in need of a fix, feeling upset and not being able to tell the person why, feeling worried about upsetting someone or not being able to deal with it. So rather than having healthy coping strategies, which I didn't have back then, it became the turn to. And of course, it temporarily offered relief from the difficult feelings. However, it creates further problems, more negative feelings, as all those problems are still there. They don't get resolved through binging and purging. And then you're also dealing with the shame and secrecy of living with the illness and the devastating impact that it has on your self-worth. Now, when you are self-induced vomiting, I think it's very typical for someone that's struggling with this behaviour that to the outside world, they often seem to be a coping person, very happy, there's kind of pleasing front to the outside world. They might avoid conflict, go with the flow, be quite accommodating of others, showing up well in their job. And if you saw this person from the outside, you may have no clue that there's an internal struggle going on, okay? So it's very isolating illness. And then behind closed doors, the purging is an emotional coping for everything that is suppressed on the outside, and in your own sort of inner world. So it's a pushback often against the demands of life, the demands of relationships, perhaps where there are not healthy boundaries in place, the emotional cost of not speaking your mind and accommodating others. It becomes a way of, really sort of almost like trying to kind of split off from all your negative emotions and to deal with those behind closed doors. So then out in the world, you're kind of presenting this coping front. So it creates a lot of mental distress because there's this real discrepancy, this kind of splitting between what you show the world and then what's going on behind closed doors. And it creates a lot of shame. You kind of feel like, oh my goodness, I couldn't show people this side of me because I'm this kind of monster that has no control, and people aren't going to accept me. And then it kind of reinforces that need even more, almost to kind of be presenting the coping happy front. And that split is just so unhelpful for your mental health. I know it's something I really struggled with a lot, and it really caused me to just lose my whole sense of self. I didn't really know who I was, what I liked, where my boundaries were. I was a bit all over the place, really. But I want to say to you now, I've been out the other side of this for a very long time now. Healing is possible, okay? You can be in very, very, very dark places with your eating disorder and you can recover, okay? So I think this kind of splitting thing in purging behaviours is quite common. So I talked about the emotional side where you're kind of coping outside in the world behind closed doors. It's the kind of like you feel like all the negativity kind of implodes, but it also mirrors what's going on with the eating, because often as well out in the world, and what we're trying to do is to kind of eat clean, eat healthily, eat controlled, like present this very kind of coping front. And then behind closed doors, we feel like we're unhealthy, forbidden, secretive, wildly out of control. It's a real kind of splitting. Okay, and I guess with our healing as well, it's about embracing much more of that middle ground, because no human being is all perfect, all pleasing, all accommodating, etc. And no human being is all wildly out of control and destructive and, experiencing negative emotions all the time. But we all have, our shadow side. It is part of us, and part of the healing process is going to be sort of learning to be able to integrate that. Okay, so I wanted to stop self-induced vomiting years before I actually managed to do this. And back in the day, I'm quite old, there wasn't much help available for treating disordered eating disorders. I couldn't talk about it to people. I felt really, really ashamed. It is possible to stop though. And I say this having lived through 7+ years of an eating disorder, doing regular purging and coming out the other side. It's not always easy, but it is possible. So believe it's possible and you are halfway there. So let's talk now about number 2 point, ambivalence about stopping the purging behavior. So there's often ambivalence about stopping purging. Okay, so part of you might hate the behavior and want to stop it. Part of you might be terrified about what will happen if you do stop it. You might fear unbridled weight gain, constant binge eating and overeating with no kind of get out. And part of you might even like doing it or feel reliant on it to cope. So if you stop, of course, it does take away the freedom to eat whatever you want in whatever quantities, and this can feel scary. And your eating disorder might actually think vomiting is good, as any behavior towards weight loss or pursuit of thin is welcomed despite the cost to your body. So it is good to have a reality check about purging, as you may well have become quite desensitized to the damaging effects of it. So the costs of purging are high, and actually it is an incredibly destructive behavior. So I'm not saying this to kind of shame anyone or cause a lot of anxiety. I'm just sort of like saying this as a reality check, because I think sometimes we become very dissociated from what we're doing. We don't see it as a damaging behavior anymore. We see it as a kind of habit and something we do, when actually it is destructive. So purging can cause low potassium levels in your body, which can be quite dangerous. You know, we need our body to be in homeostasis, to be in balance with our electrolytes, which are sodium potassium levels in the body, to maintain the electrical activity of the cells in the body. So particularly things like the heart, you know, that requires certain levels of potassium to function properly. Now, if we are purging a lot through self-induced vomiting, our sort of body homeostasis becomes very unbalanced. You know, we often purge and then we might drink a lot of water, so our electrolytes get all out of sync. Now, if we're doing this a lot, it's really, really not helpful for us, and actually we can actually have really low potassium, and that can be in, like, you know, serious cases really, really fatal. It's very unusual that people would like die or have a heart attack from bulimia, but I guess it is possible. You know, it is possible, but you know, I don't want to sort of scare anyone here. These are more the extreme cases. But if you are experiencing low potassium in your body, you might experience things like muscle weakness, muscle aches, muscle cramps, maybe heart palpitations or an irregular heartbeat. So all these things can be sort of symptoms. If you are listening to this and you recognize yourself here, you can actually get potassium supplementation from your GP if you are in a place at the moment where stopping purging feels really, really challenging. Okay, so do get support for that if you need to. Most GPs now are much more aware of purging and will support you with this. Purging as well can also result in damage to the esophagus, throat, stomach sphincter. You might find that you end up vomiting blood, and vomiting regularly also brings the stomach acid up into your mouth. You know, very acidic, whereas our mouths are sort of neutral in their pH in terms of their, you know, they're not kind of strongly acid or alkali, they're kind of very neutral, whereas the stomach, very strong acid. So if you're bringing acid up into your mouth, you're going to really erode your teeth enamel. And I know for myself, during the time I actually had bulimia, my teeth actually didn't suffer too much at the time, although I would often get really sore throats. And I think I got more problems with my wisdom teeth at the back because of vomiting. I think everything was just aggravated. But in the sort of decade after I was, you know, had recovered from bulimia, I had a lot of work done on my teeth that kind of caught up on me, really. I had a lot of sort of damage done. And obviously that can be really, really expensive as well. You know, something we don't want to have to do. We only kind of have our, you know, adult teeth, and we want to be able to look after them. Frequent purging as well can cause issues to the digestive system. So many people with bulimia experience digestive problems, including acid reflux and stomach pain. The sphincter controlling the esophagus might become weaker, and that can mean that you get a lot of acid reflux, that you get kind of rumination of food up into your mouth, which can be really unpleasant. You might also get things like diarrhea, bloating, constipation. So I'm talking more as well probably about the more extreme effects of self-induced vomiting. But I think it's just really worth noticing this as well, understanding this, because of, you may be in the early days of your self-induced vomiting journey, and you may feel like actually at the moment it's having no impact, but it's really remembering that actually this is a destructive behavior. There's a lot of wear and tear on the body, and you don't want to be doing it like a year, 2 years, 5 years, 10 years down the line, okay, because you're really, really going to suffer. And does it really work in terms of getting rid of the food? I mean, I think, again, this is a very hard thing to sort of quantify. I think, it's probably going to be different really for everybody's body. Research that has been done, which goodness knows how they do this, does tend to give differing results when they kind of sort of like quantify how much food is sort of vomited up. Research tends to point towards the fact that actually it's quite hard to get rid of all the food, but obviously it's probably going to be different for different people. So if you're thinking about wanting to stop but feeling ambivalent about change, it can be so helpful just to be really honest with yourself about these consequences of purging, putting your cards on the table and openly acknowledging what you're doing to your body. So again, not in a way to beat yourself up and be really hard on yourself, because this is a coping strategy. It's so important to be compassionate towards yourself, but at the same time, just to be realistic that actually I am doing this to myself and this is potentially having consequences. And I know for me, I was at a party, and I'm sure anyone that listens to this podcast has probably heard this story before, but I remember being at a party and hearing somebody self-inducing vomiting in the toilet who was suffering from bulimia when I was kind of starting my own recovery journey. And that was quite impactful for me, because I remember almost having a bit of a zoom out moment and realizing that is what I do. I don't want to be doing that anymore. And just feeling a lot of compassion for that person, and just realizing, just having a bit of a reality check about what I was doing to myself. And I think sometimes before, although I'd kind of wanted to give up, I'd also been quite dissociated from what I was doing. So that for me was a little bit of a sort of turning point. And I'm not saying that happened and I never made myself sick again, how I wish, but it was definitely a point in time that contributed to my healing journey. So time for a short advertisement break. Have you had a lifelong struggle with your weight and gone down the surgery route? Have you been caught in the diet cycle, losing and gaining the same weight repeatedly? And perhaps you pinned all of your hopes on bariatric surgery, but to only realise that head hunger, food noise and emotional eating have returned along with the fear of weight regain. You are not alone on the Gastric Mindset podcast. Safi shares real-life stories from people who have had weight loss surgery, and she interviews experts to help you understand the deep-rooted psychological and behavioural aspects that make it achievable to find long-term weight loss success. Safi is 8 years post-op and a therapeutic practitioner who is passionate about making psychological support accessible to all. The Gastric Mindset podcast is out every Friday and can be found on all major podcast platforms. So let's talk about now point number 3, how to stop purging. So stopping purging is not an easy thing to do because it can feel quite addictive. It's a habit. You might feel quite attached to it while simultaneously hating it. So if you're binge eating as well as purging, you might think, I want to address the binge eating first, because if I stop binging, then I stop purging. But I would recommend working on the purging as the first goal. Now, this is from my own experience and from working with other people. And my belief with this is that when you have the option to purge, binging will always be a feasible option. Binges will always be larger in size, more seductive, and you're always going to have that escape route through vomiting. Now, I think as well that purging can also be stopped more easily, I'm not saying easy, in the way that you might give up smoking or another compulsive behaviour. So you can live without purging, okay? We can't live without food, but we can live without purging, in the same way that we can live without cigarettes. It's not a natural thing for your body to do. Whereas with binge eating or eating generally, this is going to involve learning to regulate your food intake and eating. So I think it's hard to just stop. It can't, with our kind of binge eating healing relationship with food thing, that can't be addressed really often in an all or nothing way. We often have a bit of a messy, bumpy road to find our sweet spot. That's really normal because of when we've been in extremes, we've kind of got, the pendulum's got to swing both ways quite a few times before you can actually find your sweet spot, okay? Whereas with something like purging, you can almost like stop it. I'm not saying that's easy or possible to do, but it's not going to, you haven't got to kind of regulate purging into your daily life, if you see what I mean. So I hope that makes sense. Now, having just said that as well, if you have a different experience, get in touch with me on Instagram, let me know at the eating disorder therapist _. I do completely support the fact that there is no one size fits all approach to recovery. So I'm just telling you what's worked for me and for some of my clients. But again, you might have a different approach that works for you. So maybe you've done your motivational work. You've really thought about, what am I getting out of purging? What am I losing from purging? So you're feeling much more ready to make the change. You're really recognizing, actually, I don't want to be doing this in a year, 2 years, 5 years, 10 years. I'm experiencing so many negative consequences. So you're getting more to that place where you're scared to change, but you're more willing to take the risk. So I would say as well, you can just have a little behavioral goal initially. If you're purging so many times a week, you might want to start to think about reducing this slowly. So if you're purging, say 10 times a week, 5 times a week, you could just reduce it by 1 episode over the course of the week. So if it's 10 down to 9, if it's 5 down to 4. Okay, so how can you keep focused on sticking to that goal? You could log your eating and when your purging is happening, so you can start to develop an insight into your triggers. You could also as well perhaps have a financial incentive or something else to reward yourself with to keep on track. It's really helpful to hold the bigger picture, to notice the progress you're doing, as you're absolutely going to be tempted to repeat the old habit. Now, of course, it's more than just changing our behavior because of, the purging is a coping strategy. But I still think there is some value in just starting to work on reducing it. This definitely helped me. It wasn't the thing that fixed the whole purging thing, but just by having some conscious awareness about how regularly I was purging, starting to think about reducing it, starting to become more aware of my triggers, that was very, very helpful. So what else is helpful? We need to start adjusting to feelings of fullness and dealing with these feelings. So you may be accustomed to being either painfully full or having an empty stomach. And I guess there are many stages in between, and you have probably become a bit out of touch with tolerating those in-between stages. And you might also be experiencing stomach discomfort, acid reflux, and digestive issues, which are getting in the way of things as well. So with this, really, the only way out is through. Okay, we have to learn in increments to start to adjust to feeling more full again. Okay, and starting to realize in a way that we can live through our fullness. Anxiety about fullness will rise and fall. We're not going to feel full for hours on end. Normally it's very standard thing to feel a bit full after a meal, but that will kind of quickly dissipate. You probably find like an hour after eating, you probably can't feel that fullness anymore. And you're going to have to sort of gently expand your kind of comfort and tolerance to be able to kind of sit with that anxiety and kind of ride that wave of anxiety to realize in a way that actually nothing bad is going to happen. Your body can deal with this food. All is going to be okay. Now, some people suggest as well that what you can do is in the early stages, if it feels just too much not to actually purge, what you might want to do is delay purging, okay? So what is your normal time gap between eating and then being sick? Can you start to delay this little by little? Now, this can be really hard sometimes, particularly if you've had a really big binge, because you might just feel such a high level of discomfort and really want to get rid of the food. But actually what delaying does is it just puts a little pause in the whole process. It allows you to reconnect a bit more with your body, to come back to the reality of what you're doing to yourself, to reflect a bit more on what's going on. And sometimes then actually you realize that when you start to delay it, that actually you can delay a bit more and a bit more and a bit more, and actually realize you can ride that wave of fullness and you can come through the other side and you have survived. And that just builds a little kind of mental wall of confidence to realize that actually you can start to expand your comfort zone of fullness. Okay, and this takes time. It's going to take probably a lot of kind of repetition, and you might need to really sort of distract yourself and support yourself after you have eaten. So it is tough, but you will learn to tolerate the anxiety and ride the wave out. So distract yourself to ride out the wave. Remember that you're overcoming a destructive behavior. You will get through this. And I remember myself finding this unbearable at times. I'd want to climb the walls. I had irrational fears about weight gain, and I felt very out of control with that kind of pent-up emotion. But I came to learn that the very worst that could happen would be short-term anxiety and frustration. Okay, I would feel that in the short term, but it would pass. And even if I had a huge binge, the very worst that could happen, would be like, I might gain a couple of pounds or something. I wasn't going to balloon. And actually just living through that and realizing actually, okay, this is not pleasant. I'm finding this quite distressing, but actually, I'm going to survive this. That was really, really, really helpful. So what else helps in trying to stop purging? So stabilizing your body's physiology, the whole eating regularly, eating enough, eating a range of foods, holding your weight at a place where your body is happy. Because if you don't do this, you're always going to be vulnerable to overeating or binge eating, and then of course purging. So that's a hard pill to swallow sometimes, because you might feel very ambivalent about, if you're holding your weight under where your body is happy, you might feel really, really reluctant to let that go. But it's starting to realize that if you're doing that, you are kind of feeding into this binging and purging cycle, or even just kind of purging cycle, which is not a good place to be. And the final key in the puzzle for me as well, and a really important part, was dealing with the emotional coping of purging. So purging was a coping strategy. It was a way of dealing with negative emotions rather than dealing with them in a healthy way. I would almost purge them out, try and wipe the slate clean. And, things like as well, I was trying to please everyone. I had no boundaries. Purging became a way to deal with frustration, resentment, anger, rather than laying down healthy limits with people. Other emotional triggers for purging included things like burning myself out through overwork, not having enough rest and relaxation. So binging and purging for me became a shortcut to try and give myself a break, some soothing, some rest. So learning to deal with your emotions in a more healthy way is an important piece of the puzzle. And you might well need to work with a therapist around this to learn to manage and process your emotions safely, and to begin to implement more helpful and constructive coping strategies. So food and purging may become the way to soothe, distract, to numb, escape, and almost kind of wipe the slate clean. But actually, these aren't healthy ways of coping. It's important to be able to learn to find your voice, to communicate your needs, have healthy relationships, express your emotions, increase your self-awareness of your thoughts. All these things, can be really, really helpful. But you might need to do that in therapy because it can feel really, really hard if you've been coping in maladaptive ways for a long time, and maybe you've never been modeled or had the emotional support in place where you've been able to develop healthy coping strategies. So be kind to yourself. So the good news is as well, you don't have to be completely emotionally sorted to stop purging. The emotional side of coping is definitely something that I continue with to this day. I mean, I haven't purged for years, but I still struggle sometimes a bit with people pleasing or fully regulating my emotions in the most healthy way. But I no longer turn to purging as a way of coping. So I think that's a really important message as well. You don't have to be kind of perfectly sorted out to be able to stop purging. And I think I can't stress enough the important piece of the puzzle as well is that you do need to be getting out of a place of restriction, because if you are restricting, if you're holding your body in a place where it's not happy, you're always going to be vulnerable to all these behaviors, to binging, to overeating, to emotional eating, then feeling uncomfortably full, and then falling into purging. So, if you can really work on that, it can be incredibly helpful. And again, you might need to get some support if you're feeling very, very stuck. So I hope you found this to be helpful, to give you some insights into this often, secretive and shameful behavior. And I hope you've gained more understanding and knowledge. And I hope it's given you some reflection and thoughts about whether you are ready yet to stop purging. So do get in touch if you want to share anything about your own journey. And I just want to give you hope and encouragement. You know, someone who used to rely on purging as a sort of daily practice at times of my life where I felt just so out of control around food. So hopeless and helpless, and as though, you know, my self-worth was on the floor. I never really saw a way out of this. And I feel just hundreds of miles away from that place today. Okay, so it is possible. Wherever you are right now, it's possible to recover. So thanks for listening. I appreciate every one of you. If you're not following me already on Instagram, do seek me out, the Eating Disorder Therapist _ for further support with your relationship with food. Do go to the eatingdisordertherapist.co.uk. And if you enjoy this podcast, I would be so grateful if you'd follow, rate and review, as it helped it reach so many more listeners. Thank you so much for listening today, and I look forward to sharing another podcast episode with you very soon.